the most important thing is home-based child care program. In our home-based child care program, we have trained a local tribal female, semi-literate to illiterate female, for identifying the illnesses in the community and the treatment. They have been trained for treating illnesses like diarrhea, malaria, pneumonia, newborn disease like neonatal sepsis, birth asphyxia, low birth weight baby, premature baby, etc. They have served many critical babies suffering from neonatal sepsis, birth asphyxia, and from diarrhea, malaria, pneumonia. They have been also trained to treat severely malnourished children in the field itself. So I think this, as I have told, there are no doctors and specialists in most of the hospitals in Melghat, and people are reluctant to go to hospital for availing the facilities. This home-based child care is the best way to take care of this issue of child death and malnutrition in this area. Second thing is, which we adopted, is home-based treatment for severely acute malnourished children itself. That is called Samman program, where these children have been severely acute malnourished children. They are being fed WHO prescribed ready to use therapeutic food prepared by our organization with the help of local tribal female from the locally available food material. So it is low cost sustainable solution for treatment of severely malnourished children. The third approach we adopted is counselor program. As you know, there are around 13 to 14 hospitals in government hospitals in Melghat, but the conditions of the government hospital was very bad. The doctors used to close the hospital after 12. There were no ambulances available, no proper food and medicines were given. So our male and female counselors, they used to admit the patients, especially pregnant ladies and children in the government hospitals. They try to take care of them. They were acting as a bridge communication between the government doctors and the poor tribals, as they were from the same community, and they also tried to strengthen the existing government health system. Like if somebody is not getting ambulance, they will arrange the ambulance. If the doctor is closing the hospital after 12, they will ask the doctor to stay in the hospital for 24 hours. So there was significant improvement in government hospitals after this counselor program. I think this is one of the innovation which nobody tried in India. Then third innovation is of nutrition garden. We have developed around 2000 nutrition garden in 16 villages of Melghat, which produced enough quantity of fruits, vegetables, pulses, etc. And it will be a sustainable model and long-term solution for treatment of and prevention of malnutrition. Then next approach I suggest is intensive behavior change communication program for improving the health and hygiene of the people, for the nutritious status of the people. I like to quote one example. We have not given any form of supplementary nutrition or treatment to the pregnant ladies, but our village health workers are regularly giving health education at least 3 to 4 times for each pregnant ladies during their pregnancy. They are advocating hygiene, proper nutrition, then advocating proper immunization to these ladies, and due to this the maternal mortality rate has been dropped by 50%, and the prevalence of low birth weight baby has been reduced by more than 50%. So intensive behavior change communication will have great impact in reducing malnutrition and child death as well as maternal mortality in any tribal area, I think, of India. So this is the major innovation we did. Then second thing, I think there are some issues which has to be solved at the level of government. Like government must compulsory post at least one MBBS doctors in all government hospitals. These doctors should not get their some certificate for practice unless and until they finish 1 year posting. They should be given extra incentives like more salary to doctors who are working in tribal areas. There should be some reservation for postgraduate seats in medical colleges for those MBBS students who have finished 3 years service in such tribal or rural areas. Then there should be permanent posting for such doctors working in tribal areas. If government will provide such incentives and such compulsions, then I am very confident that all primary health centers and rural hospitals of tribal areas will get good quality of MBBS doctors. Similar is the condition of specialists like gynecologists, pediatricians, anesthetists, etc. So there will be compulsion for such specialists in these areas, compulsory posting, then definitely there will be uh, much more specialists will prefer to stay in such area. Like government can ask bond of around 50 lakh rupees for from each candidate. Then all sort of specialists will be present in all government hospitals. So this can be one of the solution uh, for tackling the issue of lack of or scarcity of specialists and doctors in such areas. Then fourth is starting the nutrition rehabilitation unit. The if government will start nutrition rehabilitation unit in each of these government hospitals with a nutritionist at least one in each taluka, then definitely there will be improvement in the nutritional status of the children of this area. So government will do this small thing. I think there will be a lot of reduction in child deaths and malnutrition. Another innovation what we tried is involving the medical colleges of India. If each medical college will adopt one tribal hospital from tribal area, then they can depute on rotation basis all experts like gynecologists, pediatrician and anesthetists in such area. So doctor will also prefer to come at their house. They will have to stay just for 1 or 2 months here, and the area will get experts, and the doctors also will get exposure of the real status of India, especially child health, maternal health issues. So, and we tried it since 15 years. We have tried our hospital with Mahatma Gandhi Institute of Medical Sciences, Sevagram, and Kasturba Society. So, this area, more than 1 lakh patients have been treated in our hospital. Similar model can be replicated all across India. So, these are the few solutions I think will be able to tackle similar problems in other parts.